Melanie Grant here. This video is our part 2 of medical decision making for our coding extended shorts. We're going to look at a brief overview of what is medical decision making and how it's selected. We will be doing in part 3 where we go into those individual elements on their own. So let's get started. I'm going to share my screen here and we'll be using the 3M version of our coding book here. You'll notice that we're looking at the evaluation and management guidelines. Let's make that a little bigger so we can see it just a little better. All right, so if you open up your CPT code book, what is the first thing you see when you go to evaluation and management? Many pages of guidelines, and they can throw you off. Goodness. If you look at all of it at once, it can be a little overwhelming, but never fear. There's different pieces that are meant to be broken down to help you understand this, and you'll be coding these like a pro in no time. The first thing we look at when we look at guidelines is the level of E&M services. For this video, we're just focusing on number 1, the MDM as defined for each service. Now, as we'll talk about in future videos, time is another key factor in selecting your E&M, but we're not going to focus on that today. For the medical decision making, there are a lot of guidelines. The things to remember is that medical decision making is classified to 4 types: straightforward, low, moderate, and high. And of course, this will change depending on the E&M code itself. Don't let that throw you off. This is always going to be the same on how we select these, with the exception of some of your ER visits. Okay, so the big thing that we're looking at today, how is the MDM determined to be straightforward, low, moderate, or high? Sometimes your provider is going to come in and say, hey, I did a low visit or a straightforward visit. It was just a really low, coded as whatever it was. And you may come back and look at that documentation and say, let's make sure we capture this correctly, because our job as a coder is always to get the most accurate and complete documentation and visit based off of that documentation. So there's 3 things we will look at. The first is the number and complexity of problems addressed during the encounter. The second, the amount and or complexity of data reviewed and analyzed. And the third is the risk of complications and or morbidity or mortality of patient management. Whew, that's a lot of words to say all at once. I like to simply look at this in a very simplistic manner. How many problems did the patient have? And we look at those later as to what type they are. What kind of data, like tests and labs, were done? And what was the final decision for the patient's management, the treatment, right? Another way to think of this is how much time the provider had to spend addressing everything, how much time after the visit will be spent looking at all the data and complexity, and how much of their knowledge goes into that visit. And again, this is not the time so much, but it's the breakdown of what time is spent on. So your guidelines are going to break these up and give you all of your terminology, and it can be a little overwhelming at first. There are a lot of tools that are available, and rather than coming into your code book and looking at these each individually, I like to take it away and go into the world of the internet and find something that will be a little more helpful. So you have a couple of tools. This first one here is actually from highmarkprc.com, and this is a 2023 outpatient E&M audit tool. Those outpatient E&M audits are the same for 2023 as they are for the current year. And so this one is simply, you'll notice the codes here to the left for outpatient and other services. It does make it a lot easier when looking at these, however, whether you have your codes to the left or you simply say, I'm going to use this for other areas. So the first thing you'll notice that the 99211 doesn't have anything there. There are absolutely no elements required for the first level or level 1 visit. We call that a level 1 at the end of that code because this is a nurse's visit. You'll notice there's only one code available. It's level 1, and this 1199211 is representing an outpatient. They're all outpatient. Your established patient. Your new patients are these 0 numbers. So you have 02, 03. Those are new patients, as opposed to 12 and 13, which are established. Wow, I'm just mixing up our words here. That's not clear as mud. I don't know what is. I've gone ahead and done the liberty of printing this to PDF. I find it easier to download to my computer instead of looking at it in a web base. I like to see it in PDF where I can come in with this little highlighter tool. Alternatively, you can also print these out and laminate them or put them in a plastic sleeve. If you're a hands-on person like me, that can be very helpful when being able to go in and highlight your services. Okay, now you'll notice there's a few extra things in here. We're going to skip these first couple of pages and come straight down to page 3 for our audit tool that we were just looking at. And there's a couple things that we're going to see. 2 of the 3 elements for the level of medical decision must be met or exceeded. So that's just talking about these elements at the top. And again, those are, what are your problems? What is the data? And what are the risks to the patient? Okay. So you'll notice here the level of medical decision is 2 of 3. It's highlighted again for you. And then you'll just come in here and determine based off of your documentation. So let's do a quick example. You have a patient that you reviewed documentation for who's coming in for a very straightforward visit. They're doing a regular review on their medication for diabetes, hyperlipidemia, and hypertension. The provider looks at all of their current symptoms, documents a pretty minimal exam, and reviews over their most recent lab work. At the end of the day, he says, or she says, go ahead and continue prescriptions as prescribed. Is that enough information for us? It is. We've told you how many problems they have by telling you the diagnoses of diabetes, hypertension, and hyperlipidemia. Those are all chronic conditions. So you'll come in here and find chronic conditions, but you'll notice that these are classified by 1 versus, if you keep reading, 2 or more stable chronic illnesses. So we're going to remove our first highlight and just grab this second one here. The next thing we mentioned is that they looked at their most recent lab work. And I didn't give you the specific details because the lab work and the data does get a little complex. For our visit today, in this example, let's say that they met category 1 of test and documents with a combination of 2 of the following. So that's just simply limited. And we'll look at that in another video when we go over the detail of data. The last thing we mentioned was that they're going to continue taking their medication as prescribed. And so when you look at the risk of that, it seems like it's pretty straightforward because they are already on the medication, there's no changes, and they didn't need anything new. However, the level of risk to the patient and the knowledge for the provider to say if this prescription is correct does go into effect when looking at your medical decision making. And you'll find prescription drug management here under your moderate level of medical decision making. Now we can look at the full visit as a whole. Remember, we need 2 out of these 3 elements. So we look at the highest level of problems, which is moderate. You'll notice, just to keep in mind, anytime you have that higher level, all of your lower levels are included. Your highest level of data is going to be limited, which includes, of course, minimum or none and none. And then your highest level of medical risk is moderate. And again, that includes your lower levels as well. Well, when we come in here, we can see that there's 3 elements for a low, there's 3 elements for straightforward, but we only need 2, so we should code a moderate level of visit, which, depending if the patient is new or established, is your level 4, 99204 or 99214. Those seem pretty simple when we put it with a non-complex visit. However, when we go over these in the future, we'll go into some of those details and see exactly what's built in. That's all for this time. Make sure you join me next time when we look at medical decision making, part 3, the details. And of course, we'll come in for our final evaluation and management coding on time-based management in about a week or so. Thanks for joining us today. I'll put a link to that auditing tool that we looked at today. And if you have any questions, comments, or you want to subscribe, please feel free to drop me a line.